What is the recovery like after prostate surgery? What can I expect? How much pain will I have? These are important questions that patients should ask their physicians. Typically, I'm always impressed that patients that have undergone prostate surgery, whether it's open techniques or robotic techniques that are used, the pain from this operation is relatively minimal. Many of these patients don't even use pain medication, Tylenol or a minor Motrin or those types of drugs typically work in most patients. Some patients may require a narcotic for a short period of time, but the pain that one has is very different than any other organ that I'm familiar with. These patients typically, if they have a robotic technique done, are typically in the hospital overnight and are able to go home the next day with their catheter in place. And the catheter stays in place for about 1 week after a robotic prostatectomy. Some physicians like to get a special x-ray, a cystogram, on their patients after a robotic prostatectomy. Some don't. And that's really a discussion that one should have with their individual physician. If you have an open prostatectomy, some patients have their catheters removed as early as 5 to 7 days, even after an open prostatectomy. But in my experience, the catheters remain in place slightly longer than those patients that undergo robotic surgery. But what's impressive about prostate surgery is patients have very little pain. The most common complication that we see after either a robotic prostatectomy or an open prostatectomy is gas pain. Once patients are able to start moving gas and passing gas, typically they can be up walking around without any problem. In my prostatectomies, I like to have patients up that evening walking around the floor, and then the next day they'll walk, they'll eat breakfast, and then typically leave the hospital and go home and recover at home. Patients can walk up and down stairs. We don't like to have patients lifting anything. Whether you have it done robotically or an open surgical technique, the healing process of the body is the same. One has to allow the sutures to work and the anastomosis where the bladder was sewn back to the urethra. That healing time is the same whether it's an open surgical procedure or a robotic procedure. I do believe that the return to work and return to normal activities may be slightly quicker with a robotic technique.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.